everyone. My name is Chiamaka Achonwa, and I'll be sharing with us briefly on the epidemiology and control of HIV/AIDS in South Africa. So let's get right into it. This is my outline. HIV, it just stands for human immunodeficiency virus, while AIDS stands for acquired immunodeficiency syndrome. It's a global health issue that affects millions of people worldwide. AIDS refers to an advanced stage of HIV infection. At this point, the immune system is compromised, which now predisposes the patient to opportunistic infections and diseases. There are different modes of catching this deadly epidemic. One of the most rampant modes is the unprotected sexual intercourse, which could actually be heterosexual intercourse, or even men having sex with men or women having sex with women. Another mode of transmission is sharing of contaminated needles or sharp objects such as clippers, shaving sticks, knives, and whatnot. Mother-to-child transmission is another mode of infection whereby the infected mother transmits this deadly disease to the fetus in the belly, and also through lactation and breastfeeding. The most rare form of infection is the blood transfusion, because the health care system has actually progressed and moved forward, in the sense that before transfusion these days, they vet the blood that is up for transmission, they screen it and ensure that it's actually safe for transmission. So HIV actually has no cure, but it doesn't mean it's a death sentence, okay? A person with HIV can live a healthy and normal life, provided they get on their ARTs, the antiretroviral drugs, and they are religious with it. So a brief background on South Africa. South Africa is actually located at the southernmost tip of the African continent. It's a country with diverse geographical features, and complex social and economic landscape. So according to the worlddata.info, South Africa spans approximately 1.2 million square kilometers, which is like 466,010 square miles. And it is bordered by the Atlantic Ocean to the west and the Indian Ocean to the east. So South Africa is actually a home to large and diverse populations that are different. There are different ethnicities or ethnic groups in South Africa. South Africa was said to have an estimated population of 60 million people, making it like the 24th populous country globally, according to World Bank. So the population is characterized by various ethnic groups, like I said. They have the Black Africans, they have the whites, they also have the mixed race, as well as the Indian and Asian community. So looking at the socioeconomic indicators of South Africa, you would say that is an upper middle income country with significant socioeconomic disparities and a high Gini coefficient, which actually means that it has a high level of income inequalities, meaning that South Africa has people that are very rich and then it has people that are very poor. Politically, South Africa is a democratic country with a very stable government. It underwent a significant transformation with the end of apartheid in 1994. Since then, South Africa has actually made strides in social and economic development, but the only challenge they've had thus far is the fact that they are yet to address the poverty, unemployment, and the inequality in the country. A quick background of the outbreak in South Africa. So the first case of what would later be identified as HIV and AIDS were recognized in South Africa in the early 1980s. It was actually 1982 to be precise. However, the severity of the situation was actually overlooked and misunderstood by the government, because, they had the problem of the whole intense struggle with the era of apartheid. So amidst the backdrop of the political unrest that took the entire media, HIV kind of like gained ground, affecting several populations such as the gay community and especially the Black people. So The South African government's response was characterized as denialist. They didn't want to pay attention to this. They felt like it was something that could easily be overlooked, which now led to an estimated death of over 330,000 people, So before they now decided that, oh, this is actually serious, and decided to pay much attention to it. Over the years, South Africa has consistently had the largest population of people living with HIV globally, but they've actually made efforts to control and mitigate this, the spread of this epidemic, and the actions they've been taking thus far has provided positive outcomes. So fun fact, South Africa has approximately 3 million people on ARTs, which is like the largest number in the world. So now let's go into the methods of surveillance. From my research, I found out that they are actively involved in 3 major methods of surveillance. The first is the behavioral surveillance survey, which kind of like targets specific populations at higher risks of HIV infection. And then it helps assess their sexual practices, the knowledge people have about HIV, and the behaviors related to HIV. One of the ways they do this is by the South African National HIV Prevalence, Incidence, and Behavior Survey that they conduct periodically. Now, coming to the antenatal HIV surveillance, they found ways to monitor this prevalence among pregnant women by providing like an indirect measure of HIV incidence in the general population. How do they do this? This is done by ensuring that every pregnant person that comes to the hospital tests for HIV 1 and 2. This way they can be able to, monitor the incidence in the general population. And then they also have the sentinel surveillance. This particular one is the one for every person in the country. This surveillance sites are established in like various healthcare centers, also in medical centers, the hospitals, like trucks, places that just, that you can walk into and test to help monitor this prevalence and trends in specific populations. Example, for people that have tuberculosis or herpes, or most of these conditions that come as a result of complications from HIV. So now talking about the epidemiology of HIV and AIDS, South Africa actually has a significant burden of HIV and AIDS with high numbers of cases, prevalent rates, and estimated incidents. The burden of HIV in South Africa is actually very quite tumultuous. Like in 2020, UNAIDS estimated that 7.7 million people were living in HIV and AIDS. In 2019, also, the estimated incidence of new infections in 2019 was roughly 240,000 people, and it resulted to a substantial number of deaths, with an estimated 71,000 AIDS-related deaths reported in the same year. So South Africa has had like the highest number of people living with HIV and AIDS compared to their neighboring countries like Eswatini, Lesotho, Botswana, who also equally have high rates of HIV burden. HIV prevalence rates in South Africa shows disparity across different groups, So among gender, we can say that the prevalence is actually higher among women. They account for like 63% of all new infections. Can you imagine that? So young adults and those in their productive years, aged 15 to 49, are particularly affected by HIV and AIDS. The prevalence rate among women aged 15 to 49 was 25.8 in 2017, while for men it was 14.4 among the same age group. So you can see that it is obvious that women actually have a higher prevalence than men if you compare the rates in 2017. So when it comes to the particular age where the prevalence is higher, they say it peaks in the 35 to 44 age groups, and then it slowly declines as they get older. It is also more prevalent among Black South Africans as compared to their other ethnic groups. When it comes to the areas that are most affected by HIV and AIDS in South Africa, I would say the urban areas or the urban settings have a higher prevalence than the rural areas. So female workers also have a higher prevalence than the male sex workers. Female sex workers, then there are also certain people that have a higher prevalence or high risks of contacting these infections. We have the men who have sex with men, migrant workers. So here is figure 1, 2, 3 through 4 that shows a very high prevalence of HIV and AIDS according to age and gender. So you can see the blue line indicates that the women is quite high from what you can see here. And then the orange line indicates that the men have a lower prevalence. You can also see that the age from 25 and above, it keeps going up until it reaches 45, and then it starts going down. We can also see here that the Eastern and the Southern Africa have a higher prevalence of HIV and AIDS. From what we mentioned earlier, South Africa is under Southern Africa. So you can see that they have a higher prevalence according to region. And then coming here, you would also see that the women, which is the blue line, have higher prevalence than the orange line, which is for the men. So in every group, the blue line is actually higher than the orange line. So moving on, we'll talk about the prevention and control strategies. Because of time, I might not really go into them one by one, but these are the prevention and control strategies that is being undertaken by stakeholders in South Africa to mitigate this epidemic. For the government policies, they kind of like created programs, initiatives to help promote awareness, campaigns and that advocate for safe sex practices, ensuring that the antiretroviral therapy is available for all. And then they've also provided HIV testing and counseling at every point, at every establishment. Then there is also ways to prevent mother-to-child transmission. They've implemented this by, having comprehensive PMTCT programs that include HIV testing for pregnant women, provision of ART prophylaxis and treatment, self-vetting practices, as well as guidelines for infant feeding. They've also found ways to promote safe sex practices. They distribute condoms in every street and every establishment in South Africa. And then the implementation of antiretroviral therapy and ensuring that these treatments are available for all. So talking about the challenges they've experienced so far in controlling HIV and AIDS, we'll talk about the health system constraints. So they've had serious challenges because the high prevalence of this HIV places quite a heavy burden on their healthcare facilities, leading to overcrowding, resource limitation. They don't have enough funds to fend for everyone, and the healthcare workers are overwhelmed because of the crowd. There is also lack of education and awareness, the lack of this awareness among the population. There is serious misconceptions, there is myths, stigma surrounding HIV patients, which has contributed to poor knowledge and understanding of the disease. There is also limited and inadequate sex education in schools, and communities. So this has led to serious challenges in mitigating this. There is also the issue of socioeconomic disparities. So this has posed a significant challenge because poverty often drives the individuals to do things they would not normally do on a regular, like the females going to prostitutions in order to fend for themselves. They go into sex for money just to be able to meet up with their daily demands. Then you have the cultural barriers. Their beliefs also impede the effective control of this epidemic. There's also the issue of multiple and concurrent partnership and gender-based violence. The gender-based violence against women has also contributed to women having higher prevalence of HIV. There's also the stigma and discrimination. Nobody wants to come out and say, this is my status, because they are scared of being ostracized or stigmatized. So they keep quiet, which now leads to their situations getting worse and then distributing these infections to people. Then there's also gender inequality, like I mentioned. It plays a critical role because there's disproportionate burden of HIV due to complex interplay. The women don't have the mouth to say they don't want to engage in sex, and at the end of the day, they are the ones that are at high risk for this infection. So now my thoughts about the effectiveness of their effort in the control of HIV. So they've actually made significant efforts to control the HIV and AIDS epidemic, particularly in the way they've increased their treatments, the way they've implemented preventive strategies, they've improved access to testing, and whatnot. The country has actually gone a long way from where they began. But I would say that challenges such as stigma, discrimination, and unequal access to healthcare has actually been the issues that have kept them stagnated. And though they've not gone so far in the prevention or total cleanse of HIV and AIDS, but they've made quite significant progress. So now talking about the prevention and control strategy, I believe would do well to, cause a significant change. I believe that if there is implementation of comprehensive sex education in schools, in their national curriculum, it will go a long way to deliver this much needed control of HIV/AIDS. Okay, so if they are able to deliver this consistently across all schools in the country, get trained teachers and educators to deliver this curriculum, utilize interactive teaching methods so that the kids will not be scared to air out their views, it will go a long way to bring up kids and adults that would just end the practice of unprotected sexual behaviors, so that nobody will be ashamed or scared to air out their sexual preferences, their sexual practices. They'll be able to say, no, I do not want to do this, and stand by it. This is the concluding part of my presentation, and I hope I've been able to touch the key points of the journey South Africa has undergone thus far when it comes to HIV and AIDS epidemiology and control. So these are my references. I'll be happy to take any question you may have. Thank you.